Been here for 6 months, and I've been loving it, enjoying it here. Rod asked me to just spend a few minutes just to introduce myself and talk a little bit about what I do here. And before I do, though, I wanted to kind of ask you all, besides Will can't answer these questions. If you know any occupational therapists, does anybody here have an occupational therapist in the family? Anything? Who knows what occupational therapists do? Yes. Yeah. Okay. Yeah. What were you going to say?
More restorative, more daily activities.
Okay. Yeah.
Work related.
Okay. Yeah. Daily activities, work related. Yes. Were you going to say something, or was it?
Like fine motor skills.
Fine motor skills. Yeah. Anybody else? Do you have one, Jared? Okay. Yeah, I think all those things that you said. A lot of times people think occupational therapy and they think immediately they're going to help you find a job. And that's not true at all. I may help with a job or doing your job for therapy, but I don't help you find a job. I'm not the employment specialist at the hospital. But I do help people, like you said, with kind of the, Justin? Fine motor skills is one, yes. Kind of the restorative work aspect, sure. I address a lot of what's called activities of daily living, ADLs, and you probably know what that is. But it's those daily tasks that people need to be independent. So I'm talking about the basic things: bathing, toileting, dressing, eating, grooming. Those activities are very important to a person's independence, and when they're gone, it really can take a toll on somebody emotionally. When they're not independent, the quality of life goes down quite a bit. And so, I think my main purpose and objective in every situation is to kind of look at that person and what they need to do, what they want to do, whether it's their job, whether it's their role as a mother or father or something, or even their hobbies, things that they enjoy doing that increases their quality of life. And whatever is stopping them from doing those things, I try to address those. And sometimes it's through addressing a physical challenge, like strength or weakness or something, and sometimes it's environmental changes that I look to make. But whatever the case is, the root is trying to increase that person's independence, quality of life. With that being said, here at the hospital I've been doing that. I also work on a lot of the hand patients that come in with hand injuries from Dr. Jepson, and then working in the skilled nursing, home health, and inpatient side as well, for overall independence. So with that being said, though, are there any other questions, though, about occupational therapists, therapy, what we do, what I'm doing here, anything like that? No? Pretty clear? Cool.
We're just so glad to have you.
Okay. Well, good. I'm glad to be here. Glad to be here. Very happy to be here and enjoyed it quite a bit. A few other things I think just that Rod brought up this morning. He did want me to make a few things known, just that occupational therapy is under a different reimbursement cap than is PT and speech. So it's not like they're all coming out of the same bucket, all the therapies. I am in the physical therapy department, but the reimbursement is under a different cap. So other than that, I think that's all I've got, unless there are any questions. And if not, I'll turn the time over to our capable speech therapist, Mandy.
Hi, I'm Mandy Tingey, and I'm the speech pathologist here. And I'm really enjoying learning new things and trying new things. When people think speech therapy, they mostly just think the ability to talk. But we address multiple different things. We do a lot with cognition, the cognitive aspects of communication. How much are people understanding? What are they remembering? That kind of thing. Also, we do a lot with voice disorders, so the ability to project your voice. Some people come down with inexplicable reasons why they can't talk and they're having problems with their voice. We can also address those. Singing voices too. Another thing we address a lot is fluency, so stuttering. And then swallowing disorders. We've been doing a lot with swallowing upstairs, and people who have strokes, working on getting that swallow back so that they can eat and do everything that they need to do to meet their nutritional needs. Also, with pediatrics doing the production of sounds. Can they say their R sound? Can they say their K sound? Are they using different language structures? Are they using plurals? Are they using past tense? Can they follow directions? Can they formulate a sentence? Can they tell a story? Different things like that. Trying to think what else. I don't know. Does anybody have any questions or anything else?
Do you usually have to be referred to a speech through like a regular physician? Or?
Yeah, usually the doctor does give you a referral, but a lot of times if you go to your physician and you say, hey, I have a concern with this, then they'll refer you over. They usually don't have a problem doing that. At least in my experience, they haven't. Every time I've had a parent contact me or an individual contact me about concerns that they have, and I say, if you go to your doctor and ask them for a referral, they usually get those referrals pretty quick, and doctors usually are pretty good about that. They don't have a problem making those referrals.
Does it depend too, like, on what you're addressing, the length of therapy as well? Like, it just kind of depends on the person?
Yeah, it depends on the person, depends on the individual, just like with any other therapy. Some people make progress at faster rates than others. I have some kids that we've been working on our sounds for quite a while, and then I have other kids that you come in and you teach them it, a month or two, and they pick it up pretty quickly, and they can just exit right out. Usually with kids, if the younger you get them in, the better, and they make pretty quick progress. Kids are like little sponges, and they just will absorb everything you tell them. With adults, it's a little bit harder. Sometimes especially like with dementia patients and stuff, you're trying to decrease the effects of their disease and their aging and stuff. So by doing these cognitive activities with them, you keep them using their mind and their brain, and just to kind of decrease, the progression of the disease.